I want to take you through everything you need to know about planning another pregnancy after having a baby through a C-section. This is something many women ask about, and it is important to understand the timing, the reason behind the recommendations, and what signs show your body is ready. Let me explain it clearly and step by step. One, the main recommendation and most of the guidelines says, and what advice based on major medical guidelines is that you wait about 18 to 24 months about your C-section before trying to conceive again. And this time frame gives your body, especially your uterus, a chance to heal properly and reduce risk in the next pregnancy. And why does this period matters to you? Because healing of the uterus scar is of great importance. Even though the outer skin heals quickly, the inner uterine scar needs much more time to regain strength. A new pregnancy put pressure on that scar as the uterus stretches. If you get pregnant too soon, the scar might not be strong enough, and this or some complication which slightly increase the risk of the uterine rupture. So waiting longer gives the scar time to heal well. Shorter spacing between pregnancies raises the chances of issues like placenta previa or placenta accreta. And I explained this in my previous video, so you can just go back and watch that video where the placenta attaches abnormally. This can lead to heavy bleeding and complications during delivery. Waiting reduces the risk. So the longer you wait, the lesser the risk of those complications. Also, you need to consider how well your nutrition health has recovered, because pregnancy and delivery, especially via C-section, take a lot more from the body. Something like iron levels, nutrients, and muscle need time to recover. When you wait long enough, you give your body a chance to rebuild strength, which helps protect you and your next baby. Remember, better outcomes for the baby will determine on this. And also studies has shown that very short interval between pregnancy can increase the risk of preterm birth or low birth weight babies. Giving your body time will also help ensure healthier outcomes. And how do we measure this timing, or how the timing is measured? We count from the day you delivered to the time you get pregnant again. This is called the interpregnancy intervals. So when we say 18 months, we mean 18 months from your C-section to when you conceive, not when you deliver again. What this healing timeline looks like in real life. In 0 to 6 months after delivery, this is what happened to your body. Your focus should be recovery, resting, healing, managing pain, and preventing infection. If you want to avoid pregnancy right now, we should discuss contraceptions, because breastfeeding does not fully prevent pregnancy. And 6 to 12 months, this is when your strength start returning. If you are considering conceiving earlier than 18 months for personal reasons, you need a thorough medical discussion to weigh risk and benefits. 12 to 24 months, this is the ideal period medically and what is recommended, because your uterus is usually well healed and your cycles are regular again. Your nutritional reserves, especially iron, have always recovered and free recovered. And since your body is ready for another pregnancy. Something is physical indicators. Your C-section scar isn't painful, swollen, or infected. If you don't experience ongoing abdominal or pelvic pain, your period have returned to normal, your blood test, especially iron, are normal. Those are some of the physical indicators. And medical assessment is paramount depending on your history. Your doctor might want to check the thickness of your uterine scar or review any complication from your previous birth. If you feel you need to conceive earlier, because some women have reasons based on age, maybe fertility concerns, personal circumstances that make them consider conceiving even earlier than 18 months. If that's the case, you should have personalized counseling. Any anemia should be corrected first if you have any. Chronic conditions like high blood pressure or diabetes should be well controlled before that. You may also need a closer monitoring during that pregnancy. These are increased risks with shorter spacing, but with the proper care, pregnancy can still be managed safely, though it is somehow expensive. If you hope to try a vaginal birth after C-section, what we call VBAC next time, the interval between pregnancies matters a lot. A longer interval increases the safety and success rate of VBAC. Your doctor will assess your previous C-section and discuss whether a vaginal birth after C-section is a good option for you. And remember, there is the emotional and practical readiness part of it. I always tell my client, healing isn't just physical. You need to consider 1, your mental well-being, 2, the support at home, 3, child care for your current baby, and the last is whether you feel ready for another pregnancy. These practical factors are just as important as medical one. And what you can do next, here is what I recommend depending on where you are right now. If you don't want another pregnancy yet, use effective contraceptions. Options like IUD or implant are safe after a C-section. If you want to conceive in that 18 to 24 months, plan a preconception checkup a few months before even trying for that baby. This helps us make sure everything is optimal for a healthy pregnancy. And if you wanted to conceive even sooner, let's discuss this carefully so you understand the risk and get the right monitoring you deserve. And the last point is just to clear the myth and make a good clarification on this myth. Myth number 1, you find that people normally say once you scar on the outside heels, you are fully healed. And this is the truth. The internal healings take much longer. Myth number 2, you must wait exactly 2 years. This is the truth. The safer range is between 18 to 24 months, but individual situation always vary. Your case should not be compared to somebody else's case or situation. If I get pregnant earlier, it will definitely be dangerous. That's another myth. But here is the truth. Truth is risks are higher on average, but many women go on to have a healthy pregnancy with proper care. So now you know, make your arrangement and your plan prior to the day or the period that you are planning to conceive or having your next baby. So If this information has changed